Welcome to Startup Health TV. This is a special COVID-19 health innovation update. I'm Logan Plaster, editor-in-chief at Startup Health, and I'm here today with Andrei Zimiles, CEO and co-founder at Doctor.com. Andrei, thanks for taking a few minutes with me.
Yeah, thanks, Logan. Really happy to be here.
So very excited to talk about what Doctor.com is doing. You've recently had an entry into the telemedicine market with VirtualVisit, which we'll get into in a minute. Such an important topic at this time. But I wanted to start by just having you give the viewer kind of a flyover of Doctor.com, how the company has evolved and what the current offering is at the moment.
Sure. No, absolutely. So I think like many companies that have been in the digital health space over the past 5 to 10 years, it's been a lot of evolution, and it's been a pretty exciting time and many chances to really continue to evolve where you started with a company and to stay agile and to find that where you are today has come a long way from that origin point, right? So our focus is really on solving what we would call like ecosystem-wide challenges. We look at the health space today a lot like the online travel space was 30 years ago, right? Where if you think about the travel industry 30 years ago, people were hiring travel agents to do all their travel for them, like all their booking of flights and hotels and such, because it was so cumbersome you had to hire help. Over time, through technology and through systemic platforms that help make marketplaces and distribute data and get content in front of the people who needed to get it at the right time, travel became so easy that, pandemic notwithstanding, most people will go online and in 20 minutes, can book a trip to the other side of the world, hotel, flight, rental car, and have 100% confidence that when they get off that plane, A, it landed them at the right airport, B, the hotel they walk into is open and welcomes them, and that everything goes smoothly. And we do this online travel booking almost without even thinking about it, right? It's just become a fixture of daily life. It's so trusted, it works so well. You look up any hotel, there's 1,000 reviews about the hotel that tell you exactly what to expect. And it's just something that is accepted as how things work now. Then you look back at healthcare and you look at the same experience of trying to go research a doctor, find the right doctor for a particular case, which hospital you should go to, a similar journey of needing to do some research and ultimately secure an appointment. And it is like travel 30 years ago. That's why there's a big business of care navigators, right? And all these companies helping you just figure that stuff out. And fundamentally at Doctor.com, we think there's an immense opportunity to build the core industry infrastructure that allows the online patient journey, seeking care, the journey of someone to seek care, to be modernized in the way that the online traveler journey was modernized, right? Where people can now just do that seamlessly. So what goes into that? A big part of it is data. So we spend a lot of time on what we would consider consumer-facing physician data, right? It's the information about doctors, hospitals, other facilities that's useful to consumer, right? It's biographies, patient reviews, photos of where the doctors work, insurance affiliations, all that kind of very detailed information that's not just sort of facts and figures and credentials, but what you as a person actually want to understand and you're trying to decide where you want to go.
Quick question: What are some of the data challenges that are unique to healthcare? Trying to draw this line directly from travel to health. What are some of those hurdles?
Oh man, where to begin? I'd say the biggest hurdle is that there are really no single sources of truth or sort of systems of record for provider data. In fact, even within large organizations like hospitals and health systems, it lives often in multiple places. You go into the average hospital, they have a credentialing team that has, board certifications, where the doctors went to school, sort of factual credential type data, right? And then you go to their marketing team and they have all the biographies and all the photos. And then when you try to find out the office hours that doctors have at different parts of the facility, only the doctors sometimes actually know that. So you need really minimum of three different areas within that single business contributing information to even get a broad sort of aggregated source of truth for how that practice actually works, who's in practice where, what they do best, that sort of thing, right? That's just within your average hospital.
Mm.
So then you sort of zoom that out to all the different entry points a patient could find. They could be going to a site like WebMD or HealthGrades to find a doctor. They could be going to a search engine like Google or Bing. They could be going to their insurance company's search engine. They could be going to a government hosted website, maybe a pharma brand put up a doctor finder. All of those entry points are getting bits and pieces of data from different places. Maybe they're buying it from companies to just call around to doctors' offices and hope to get people on the phone to give them
Yeah.
up-to-date
Yeah.
information, right?
Yeah.
So just the data side is a huge challenge. You could spend the whole hour talking about that. And just sort of to bring it back to what we do. So we focus on the data, which we just talked about, and then we focus on making that data actionable and really engaging patient experiences.
Got it.
So that could be a provider directory on a hospital's website that we're powering, or it could be a provider directory for a pharma brand that wants to have a native experience to connect patients with doctors who are doing research about the drugs. Could be us on behalf of a doctor making sure their information is up to date, or on behalf of a hospital making sure all their doctors' information is up to date on all those other places patients go, whether it's a HealthGrids or a WebMD or whatever. So when I say that we're trying to solve this at a systemic level, it's really about building the pipes to make sure that on the provider side, which is the supply side of appointments and of medical professionals, that there's a source of truth for those organizations to store their data in, and there's pipes connected to that to ship that data where it needs to go. And then on the demand side, which are all the different places a patient's going to arrive at when they're looking for a doctor, we make sure that they have access to that up-to-date information, including patient reviews, including bookable appointment inventory, including all the other things you mentioned. And we maintain that whole ecosystem of data getting shipped from place to place in real time. So
Interesting. It's one of those pieces of the puzzle that I think a lot of patients don't appreciate, that's happening behind the scenes. Like you said, laying the pipes that allow for a seamless experience. So critical, and yet sometimes seemingly invisible.
yeah, and look, if we're doing our job, it should be invisible, right? Because doctor.com, despite it being a nice domain name, is not really a brand that we're necessarily trying to build with consumers. They'll encounter it at times because there's certain aspects of these online transactions and such, like appointment booking, where we'll have a little bit of brand presence just so the patient knows who's looking after and securing their data. But really, our job is to ensure that all of our clients and partners can deliver the best patient experience possible, and we're the infrastructure behind the scenes.
Well, that's a good segue. Doctor.com is back-end infrastructure, but you recently launched VirtualVisit, which is a branded telemedicine product. Did you launch VirtualVisit in response to COVID, or was that already in the works?
It's a great question. Great question. So, really, it was launched in response to the pandemic. We had been working on some interesting sort of what I would call like almost like a side project in that space, right? We had some engineers in our team who had an interest in video visits and the potential that they held for the future. We had some of our clients actually sort of early adopt telemedicine technology, and we're talking about ways they were using it creatively. So we had sort of had an eye on that as an interesting space, and had done some early work there to understand the landscape and even to prototype a few things. But when COVID-19 hit, we obviously kicked that into high gear, and it went from something a couple technologists were working on in their spare time to being something we put most of our engineering horsepower on. And that's where we were able to bring something to market pretty quickly. I do think we benefited from being interested in that space in advance, though, because
Yeah.
a lot of just knowing the lay of the land we had already had under our belt. But it has been remarkable to see just how the adoption curve has trended since the pandemic, right? I think I was looking at stats, it was like 17% of physicians had used telemedicine in December of 2019, and now it's over 85% today.
Wow. Wow. So as you can appreciate better than most, the telemedicine market right now is booming. There's a lot of different entrants. There's a lot of different ways of doing telemedicine. Some people are just tapping Zoom and just hoping for the best. So what does it look like? How is it unique for a such a big data player like Doctor.com to get into telemedicine? How is Virtual Visit then unique from some of the other players out there?
Absolutely. So we felt very strongly that we didn't want this to just be an add-on business that was decoupled from what we already do best. We felt very strongly that if we were going to go into this space, it had to amplify and be amplified by all the things that we already do well.
Hmm.
And it had to be something that was made broadly available to physicians, even beyond our current customer base. Because we sort of look at this as our little way of fighting back against the pandemic, right? And so there's a few things that are very different about what we've done here. Um, First is we felt there was a really big gap between, as you mentioned, Zoom and Skype and FaceTime and Google Duo and the very solid but very bare bones sort of video chat services that weren't purpose built for healthcare, that were
Hmm.
sort of, I would call it almost like panic adopted, right? As people realize, oh my God, I need a way to just talk to my patients
Yeah.
through a video chat. And those are sort of the easy to get started, inexpensive services someone could just grab without having to reinvent their practice, right? So on one side, you have the sort of not secure, not HIPAA compliant, fast, lightweight, easy services. And on the other end of the spectrum, you had incumbent vendors like the Teladocs and American Wells of the world, which are awesome companies, but were really built for a different use case than most of what we've seen since COVID-19. They were built more for the use case of a doctor that wanted to go full time into virtual practice, or to uh, really make that a fabric of how they practice medicine.
Okay.
So we felt that there's a gap in the middle, something that needed to be as easy to use as FaceTime or Zoom, but HIPAA compliant, purpose built for healthcare, and as I was mentioning earlier, uniquely for us, connected to other things we do. So, for example, we have the ability for a patient to leave a review immediately after their visit, natively embedded within the experience. There's no better
I was gonna ask you about that because I know physician reviews has been a big part of your business, and you've pushed back. We've done stories about this in the past. You've pushed back against some of the really poor incumbent review systems, trying to really improve how physicians get reviewed. So, what does that look like in the telemedicine experience? And I don't know, like, what do you think of as the role of physician reviews going forward?
No, it's a great question, Logan. So I actually think it's particularly important with telemedicine, and especially important in these times where people are really nervous about engaging with the medical community in a physical realm as well, right? So why would reviews be extra important right now? Well, number one, a lot of people are using telemedicine for the first time. They want to know, is it a good experience? Is it a cumbersome, annoying experience? Is this doctor going to be a friendly, easy doctor to talk to? Or is this going to be something where, I'm waiting on hold for an hour, and then, I only have 10 minutes with the doctor, and, they have horrible audio quality. You can hardly hear what they're saying, right? So anytime you have something that's a health related concern, and it's new, there's new technology at play or a new way of interacting with the professional you're trusting, there's obviously a lot of uncertainty. So it's important just to reinforce that this can be a great experience for care to be delivered through. And reviews are probably the best way to do that because it provides social proof. Beyond that, as a lot of practices now are looking at reopening, we're seeing a lot of practices and a lot of hospitals right now, they're in a little bit of a hybrid model where they're still using telemedicine for things that don't require uh, physical interaction, but are opening back up with elective procedures and other types of care that would require a person to physically come into the office. Now, people are terrified to physically go into offices right now, right? I mean, for obvious reasons. We actually are advising our clients, if you're going to open it all and see people in person, you should be videotaping all the safety and cleaning procedures that you have. Don't just tell people you're doing it, literally videotape it, because people need that level of reassurance it's safe to come back in. And that needs to be almost marketed. So patient reviews are, again, very important there. If you're just reopening, you're starting to have people come back in, you can say all day that it's safe. You can even do that video, and that's great. but people will be very comforted by a flow of reviews from other people just like them who are like, oh, I was really worried. I was worried,
Yeah.
that, I might be exposed to something. I actually went to the office and it was clean. It was super professional. I felt safe. I got time with the doctor. That's what's necessary to get people comfortable to go back in.
Gotcha, gotcha. Let's go back to virtual visit a second. So you mentioned before that it's totally free. Um, who are you currently working with? Who are you going after? Big hospital systems, individual clinics, everyone? Who are you targeting?
Absolutely. All of the above. So right from the homepage of doctor.com or from doctor.com/virtual visit, literally any healthcare professional can sign up for free. One of the things that's really important to us is that this system is incredibly easy to use. There's no apps to download. There's nothing to install. There's no credit card required. There's literally nothing that would make this take more than 3 to 5 minutes to sign up and be talking to your first person
Hmm.
virtually. Um, the reason we're offering it for free, and I would even go out and say that we are the most feature rich free platform right now. We have screen sharing and chat and high def video and text message integration and review integration and distribution of telemedicine appointment booking to our partner sites. All of that is rolled into our free offering,
Hmm.
either in part or in full. And the reason we're doing that is because we do have paid offerings, and we have some hospitals working with some larger accounts where they started for free and want more capability and sort of an enterprise-wide rollout. And so it's been great for us to make the barrier to entry so low for anyone to just try it out. Because it's a great product, people are loving it, and then we can have a conversation around what a larger integration can look like. And still quite affordable. Again, we really see this as something that's most valuable to us as a business when it gets to scale. So we're not trying to nickel and dime on features. It's much more about, can we get a meaningful number of physicians on this platform, hopefully in the hundreds of thousands over time, so that there's a lot we can do with almost network effects that are tied in there.
Got it. And do you see that as an enduring, post-COVID plan, this remaining a key part of what doctor.com offers?
Absolutely, we're committed to it long term. We actually just surveyed 1,800 patients and representative demographic across the U.S., all different income levels, age groups, et cetera, and asked that group what percentage of them would still want to use telemedicine. This is the subset that had used it already. What percent of you would still want to use this after the pandemic? And it was north of 85% of people
Mm,
said that, yes, I would still want to use telemedicine after the pandemic. And that included a lot of people who'd never used it until they had to with the pandemic, right?
yeah.
So we think it's a trend that's here to stay. It may sort of have peaked in April through June time period, March through June, when people have been entirely locked down in some places, and I think it may die down a little bit from that peak, but 100% it's here to stay. I mean, if you look at the convenience of spending 10 minutes on a video conference versus losing half your workday because you're getting on a train or in a car and then an hour in
Yeah.
a waiting room and then back,
Yeah.
it
The
makes sense. So yeah.
the economic value of that, the opportunity cost, there's so much baked in there. Um, I think the timing right now to be talking about this is really interesting because you mentioned before we went through a phase of kind of panic buying. And some of the conversations I'm having recently, have really suggested that we're entering into a really critical planning phase where we made it through that sort of chaotic period. Now we know what we need to do, and now we can kind of go back to the drawing board. And I'd like to get your thoughts on it if you agree, and start to establish some of these systems in a more robust way. And there's the understanding that we could have another wave. It could be bad in the fall or sooner. And now is the time to take a breath, set it up, get it right. And it feels kind of like you're gaining speed at that moment, which is interesting.
Yeah, I mean, candidly, we missed the panic buying rush, right? We were quietly testing this and really focused on just building the best possible product during
Mhm.
the sort of March and April when most of that was happening, and that's fine. We knew that that would happen, and our service is free, so no one even has to buy it, right? So we were fine spending that time heads down, really listening to the users to refine the offering. And you're 100% right. What we're seeing, especially with larger organizations, is that there was sort of a free for all to just, regulations got lifted. People were FaceTiming with patients on their phone, right?
Right, right.
And that that's definitely starting to die down. And I think exactly as you said, there's been a little bit of regrouping. There's RFPs going out all over the place for more what I maybe would call a durable solutions that could stand the test of time, that are in fact compliant, that have a lot of security and privacy built into them. So we do feel we're very well positioned. Again, we've tried to hit that sweet spot between giving away more than what's in a lot of paid services, and when we do have a premium version that we're talking about with a client that has some additional bells and whistles and additional scaling capability, we're trying to still be very affordable and very robust. And we've been having a lot of excellent conversations and some great traction, particularly with hospitals right now in these conversations.
Very interesting. We're sort of out of time here, but I have a last final question for you that's sort of
Sure.
a shift in gears. You're the CEO of a company that, instead of scaling back during the pandemic, has actually doubled down, which is true for a lot of healthcare companies, doubled down, tripled down at a time that's been very stressful. People stuck at home, people getting sick. You're in New York.
Hmm.
As a CEO, what have been some of your strategies for leading during this period of time, in order to take care of your company, still push forward, still acknowledge the stressors that people are under?
I appreciate that question. Well, I'll tell you what I said in our all hands meeting when we first went full remote when this all hit. Um, and that is that in times of great stress and in times where you're really tested by something unexpected,
Hmm.
just sort of two types of responses that you'll see. You'll see people who have the view that, okay, there's a lot of distractions out there, there's a lot of excuses I could have, and I'm going to rely on that to kind of pull back and retreat and kind of do the bare minimum to keep the lights on, but really hunker down and sort of get away with it because who wouldn't give you a little more rope, and who wouldn't be understanding because times are tough, right? And there's a lot of people have that mentality, and that's probably some level of human nature in that. And then there's people who rush towards the challenge, who rush towards the complexity, who look at this as an absolute time to shine and to stand out and to go the extra mile and to defy the expectation that things would get worse and things would slow down and people would be more distracted and say, you know what, I'm going to prove that even though there's no one looking over my shoulder, even though I'm completely independent, I'm working from home, I'm fully remote, there's lots of stressful things happening in the world, I'm going to crush it like I've never crushed it before at work. And I am darn proud to say that overwhelmingly at doctor.com, people have fallen into that second category of just going the extra mile. And I think that's the most important thing when you're building a business, is that you walk the walk, and that if people see you and your executive team and every level of the company stepping up and doing more and looking for ways to fill gaps and support colleagues during stressful times, that confidence, that attitude's contagious, and that spreads, and people all lean into it. And so we're just very fortunate to have fostered a culture where I think that's the default that people go to, and that's carried us through. And we're back to almost where we were right before the pandemic hit. We've been very resilient. We have really rich pipeline. We're having different conversations with clients, but we're back in the game,
Mm.
and we never really were out of the game. We took a little bit of a hit like everybody else, but we're able to keep growing, hiring. We didn't make any staff reductions. We've been very fortunate. I'll be honest about that. We've been very fortunate.
That's awesome, Andre. Well, love to keep checking in with you, hearing what you're doing, and appreciate the work you're doing at doctor.com to really step into that gap in telemedicine. Excited to see what you do with Virtual Visit. So thanks for taking the time.
Yeah, thanks so much, Logan. Always a pleasure. Keep up the great work that you and everyone else at Startup Health are doing.
All right, take care, stay healthy.
Okay, bye bye.